Hey everyone, it's Micah. Today is January 15th, 2017. And today is kind of a big one. It is 1 month post-op top surgery with Dr. Garamoni in Davie, Florida. So I wanted to make a video. I'm also now a little over a year on testosterone. The 1 year mark for that was January 4th, 2017. So a lot of big milestones happening for me. So I just kind of wanted to talk mostly about the surgery. So I had surgery with Dr. Garamoni. I mean, at this point I feel like most of you already know that he's like the best in the country. So I flew down there with my partner Haley, and my parents ended up deciding to come too. So they were all there for me. We rented an Airbnb, which I would recommend. Saved me like $400. So yeah, pre-op appointment date was December 14th. We went in, pretty much talked about like what the surgery is going to look like and if I had any concerns, which I didn't because, I already did all the research. And then, I don't know, we hung out for a while, killing time. And then my parents dropped us off because they rented a car. They dropped us off at our Airbnb, and that's about when I started freaking out, because at that point it was like 8 o'clock at night and surgery was at 7 in the morning. So I was like, it's 12 hours till surgery, freaking out internally. I didn't end up getting much sleep. So fast forward to the next day, which is actually the surgery day. We go to the surgery center, and I'm his first patient of the day. So they take me back and prep me for surgery. I had to take out my lip ring. And he comes back and he draws the lines on my chest to say where everything will be, ask me if I have any questions. My parents come back to say goodbye before the surgery. Haley comes by to say goodbye. Next thing I know, I'm on the table and they've got the mask over my mouth telling me to breathe and that everything's fine. And then I'm out. The surgery only took about an hour. And it went really well, and I slept for about 2 hours, and that's when I woke up. Was someone was waking me up telling me I had to go. So they got my clothes on, they got my parents and Haley back there, and I left because it's outpatient procedure. So we get back, and pretty much for like 5 days I'm just sitting there. The pain actually wasn't too bad for me. I know some people like just get knocked out, and I did sleep for most of the day. I was probably awake 8 hours a day for like 3 days, but the pain wasn't so bad. The worst thing for me was the itchiness. The only part that was actually painful was my left drain. Not even both of them. This one was fine. It was just the left one. It was rubbing against my skin. And kind of caused a sore thing to happen. So that was the most painful part. So then come the post-op date, I go in and he's like removing the bandages and everything, and Haley's got my phone to take a picture. I didn't take a video because I didn't really want that. And he's unwrapping me, and I'm holding the 2 drains in my hand, and I look down and I couldn't believe my eyes. I couldn't believe it was real. I had to like touch it. I still do that. And then he takes out the drains, and that was nothing, although I've heard some people say that caused them some pain. It was fine for me. And I flew home the next day and been recovering ever since. It's been exactly 4 weeks to the day today I had surgery. So I'm just gonna take off my shirt and let you guys see. Don't mind me for a second here. So yeah, this is me now. It's unbelievable, actually. This nipple is really the only part that's even giving me any even remotely problems. There's like one tiny stitch still on the inside. I doubt you'll be able to see it. Sorry, it looks kind of shiny because I have Neosporin on it just to help. So they had me wear an ACE bandage. It's like 10 feet long, just for pressure and just to make sure everything heals well. I wore that for 2 weeks, and then for 3 weeks we had gauze and Neosporin and a Band-Aid over my nipples to make sure that those grafts stay. That stopped about a week ago, which was awesome. I'm so tired of those Band-Aids. They like scarred. I don't know how much you'll be able to see it, but they started to really irritate my skin. So now I don't have to do that, which is great. I'm just gonna, leave my shirt off because I can while I keep talking. So yeah, I'm healing really well. My friend said she feels like I'm like way farther along in the healing process than I actually am, and I kind of agree. I haven't really had any pain at all. It doesn't really hurt too much to touch. I try not to touch my nipples too much just because I'm still a little scared to mess with them a lot. But I have most of my range of motion. To be honest, I kind of forget that I shouldn't be doing things, which is frustrating for me because I like movement. I like going to the gym. I like being active, so it's really hard for me to not. Other than that, I started school pretty recently, and my friend Elizabeth had been kind of texting me because she was like asking how everything was going and everything, and I hadn't seen her since before I left. So it'd been about a month since I'd seen her, and I get to school and she like freaks out when she sees me, and she starts like staring at me, and like that whole first day of class was a lot because everyone was asking me like how I'm doing, how I'm healing, like it was a lot of attention, but not like the bad kind. It was just like more than I'm used to. It's kind of fun to see people after everything, and to be able to talk about it because it is such a big, huge, life-changing thing. Sometimes it still doesn't feel real. Like when I go to the bathroom, sometimes I forget that there isn't any reason I shouldn't be in there. There's nothing that will give me away. And I don't know how to explain it. Like, I'm being gendered right, but I was doing that. That was happening even before surgery. It just feels more like the chances of ever being misgendered are so slim now. Because beforehand I couldn't bind all the time, and now I don't have to. And before surgery, I'd made a list of all these things that would change after surgery, being able to swim, being able to go shirtless, like the obvious ones. But I'm finding some I didn't even think about. I really like when people put their hand here now because, well, it's just me now. It's not, there's nothing in the way. And I'm finding I like wearing white shirts again, which I didn't before because sometimes the binder was you could see it through the shirt. And now that doesn't even factor in. Sometimes shirts feel flowy almost, pre-binding everything felt tight even if it was loose because you're binding, and now if something's loose I can feel it flowing around me, which is surreal. This whole process has been surreal. I don't know if I've completely adjusted yet, which I don't think is bad. I want to continue to be appreciative of it for as long as I can, so that's been pretty amazing. The only other thing that I've been doing is scar care stuff. Everything else, I don't have to do, like, for Dr. Garamoni, now it's really up to me what I do. So, hold on, I'm gonna grab the stuff, it's right over here. I should have thought about that beforehand. Trying to think, I don't know where I put the other thing, but I started with, Scaraway strips. Silicone is one of the few things that's actually been proven to help with scars, like, scientifically, not just, like, from, like, people who've had surgery. Like, there's proof that it keeps the skin moist, and, like, that helps with scars, and also the pressure from the strips and not, like, liquid pressure also helps. But I kind of stopped doing it as soon as I stopped having to have band-aids on my nipples, because I was tired of things on my chest. You know, I've waited 24 years to have this chest, and I didn't want to deal with the Scaraway strips anymore. And that's just a personal choice. Maybe I'll go back to using them later at some point. They still help with old scars, so we'll see. The only other thing I'm actually doing every day is, I don't know where the bottle went, but I have a mix of Tamano oil and rosehip seed oil. Both have been proven to help with scars and scar healing, that I put on up to 3 times a day, depending on how much time I have, and I'll, like, rub them in. It doesn't hurt for me to touch these. If it hurts for you to rub it in, don't rub it in. That's, like, the most important thing. If something hurts, stop. So I rub it in, and then at night I started using Mederma. I don't know if it's going to focus on this. I'm sorry. Hopefully it will. Mederma PM Intensive Overnight Care Scar Cream. I don't know. I just heard some good things about it. It is expensive, so it's up to you if you really want to use it. I put that on at night. So the Tamano rosehip seed oil during the day, up to 3 times, typically only twice, and then the Mederma. I feel like my scars are doing pretty well, which I'm really impressed with. I feel like my body usually heals really slow, so it's kind of nice the one time I really need it to. It's doing its job and, like, healing pretty fast. The only other thing I took was immediately after surgery, Garamoni, in his office, they sell bromelain and arnica pills. Bromelain and arnica both help reduce swelling and bruising. And I took those until they were gone. That, I think, really helped with how it looked. Like, immediately after surgery, it helped with the swelling immensely. I think that stuff was worth every penny. I think that helped jumpstart my healing process for sure. Other than that, the only thing that ever bothered me during this whole healing process was being itchy. I don't know if any of you have had surgery or, like, had a major injury, and while it's healing, it starts itching. But that happens to me, and that was pure torture. I couldn't scratch. I couldn't even really touch it. I was scared to touch it, first of all, and, like, second of all, you really shouldn't. So that was really hard. So the other thing I would take would be Benadryl. Benadryl saved my life, because I get really irritable when I'm itchy, so Benadryl for sure. Maybe later I'll make, like, a specific tips video for surgery. I haven't decided yet. This video is already getting kind of long, so I probably won't put it in here. But something I've started noticing since surgery is, like, almost immediately, was that I noticed my stomach more. There's nothing in the way here. There's nothing that's bothering me up here. So now I just go a little further down, and there's my stomach. And we have this societal image of what a trans person should look like, specifically a trans masculine person who's skinny, white, fit, conforms to societal gender expectations, and that's not completely me. Like, I do identify as masculine, and I do use he, him pronouns, but I am not skinny, I am not white, even though I am white passing. There are parts of me that don't fit that mold, and one of the parts that's harder for me to accept is my actual weight. So that's been kind of hard and frustrating because I want to be really excited about this new change and how my chest looks because it looks fantastic. And sometimes I find that I can't focus on that because of my stomach, and that's really frustrating. Like, shirts fit great on my shoulders and my chest now, and then they go down and I'm like, why are you here? But it's here, and right now I can't do anything about it because I can't go to the gym. I mean, I'm trying to watch what I eat more, but that's not really my strong suit. I haven't decided how much I want to do about it yet, because a part of me feels like, why should I? I'm pretty generally healthy, and being fat does not equal your worth or your beauty, or so I'm trying to dissect how much of this is like what I want for myself and like what I've been like taught to want for myself, which is hard to differentiate. It's hard to separate the two, and I'm having kind of a hard time with that. I'm also finding that, like, I feel like I want to pack more now that I don't have to worry about being outed from my chest, which, look at that. Sorry. Packing is a weird subject for me. Like, I've tried the 2-in-1 STP packers, I've tried making a packer, I've tried just a regular packer, and like right now I have a little STP device that I like, that is not used for packing, so it's kind of annoying to pack because then I like have another thing that I need to adjust before I pee. But I'm finding it more uncomfortable to sit and like see that there's no, that the pants sag where they shouldn't be sagging. So I don't know if that's going to change. I don't know if this is going to stay the same. I still don't feel like I want bottom surgery, which is good because that stuff's expensive, and if I'm frustrated with this healing process, I would be with that. But yeah, overall, really happy with how this looks. I can't recommend Guillermo enough. Like, he's worth every penny. He is worth his reputation. He is worth the trip down there. Yeah, there's no, I can't put into words how satisfied I am with my chest itself. Like, I wouldn't change anything. So I think that's it for my update. I'm not sure when I'll make another one, but I hope you guys have a good day.